Labus, and I'm an infectious disease epidemiologist and assistant professor at the UNLV School of Public Health. And I'm here today to talk about vaccine myths. The COVID vaccine was fully tested and found to be safe and approved by the FDA for use in the public. The parts of the vaccine are not new. We have mRNA, the core of this vaccine, in our bodies at all time. Plus, it's what allows the virus to replicate in our bodies as well. The other components of the vaccine have been safely used previously in other drugs. So even though the vaccine is new, the pieces that make it up really aren't. The platform allowed us to produce this vaccine quickly, but that doesn't mean that the platform didn't take years to develop and that this was rushed into production without being determined to be safe. Infected by COVID, you have a short-term immunity. We know that for about 90 days or maybe more that you're protected against reinfection, but we've seen people get reinfected with COVID after that 90-day window as their immunity starts to fade. So it's important that people get vaccinated against COVID because the vaccine can give you better protection than you get from the natural infection and will allow you to not get infected and develop disease for a much longer period of time than the immunity developed by that natural infection. There's no truth to there being a microchip or some sort of tracking device in the vaccine. This is a rumor that's been floating around the internet, but there's no basis in reality for it. Plus, anything that would be used to actually track you would be large enough that you would see it as it's being infected and you would feel it under your arm. So there's no truth to the rumor that there's any sort of microchip or tracking device in the vaccine. Truth to the myth that the vaccine can change your DNA because there isn't a mechanism in your body for messenger RNA, which creates proteins, to change your genetic code. If this were the case, every time you got infected by a bacteria or virus, it would be changing your genetic code. So there's no way that this vaccine can do anything to change your DNA. It's just not biologically possible. The vaccine can make you sterile is one that we see with most vaccines. It's a common myth that comes to vaccines. There's no truth to any of it, but people are obviously concerned about their own health and own safety, and this myth seems to show up every time there's a big vaccine campaign anywhere in the world. It's not true, there's no truth to it, and there's no reason to be concerned that that would happen if you got vaccinated.